Joining us on this special broadcast here on Republic TV, I'm Niranjan, and we have three very special guests joining us on this broadcast. But before I introduce our guests and our panelists on the show, they're experts. Let's tell you what this is all about. In the next 10 to 15 minutes, we'll try and get you up to speed with something that we've been very attached to here at Republic TV and been working closely with. Diabetes, including pre-diabetes, has the highest prevalence, followed by cardiovascular disease and hypertension in India. A recent industry report has projected that these three top chronic diseases represent a market size, and hold your breath, about $35 billion in financial year 2021, expected to grow 3 times in the next 10 years. And close to 95% of the diabetic population in India, ladies and gentlemen, falls in the middle and low income category and has very, very limited access to diabetes care. It is critical for India to identify a diabetes care solution which is affordable and comprehensive. And we here at Republic TV have been working very, very closely on this program. Let's introduce our guests on the show this morning. Mr. Love Verma, who's a former secretary in the Health and Family Welfare Ministry, Government of India. Dr. Banshi Saboo, who's a chairman, Diacare Diabetes Hormone Clinic, Ahmedabad. He's also the secretary for Diabetes India. I have Dr. Pankaj Jethwani, who's the executive vice president at W Health Ventures, and Dr. Pankaj Jethwani leads investments at W Health Ventures, where he focuses on backing disruptive healthcare startups in India and the US. He's also the founder of the Breakfast Revolution, which is a social enterprise that serves over 220,000 children in India. That's over 220,000 children. Okay, let me start off with Dr. Saboo. Dr. Saboo, lifestyle diseases like diabetes have clearly increased over the last few years in India, and you've just seen the numbers and how big the problem is that we are facing here in India. Increased, especially in the last few years, driving the demand for good quality healthcare. Now, what are some of the challenges that Indians face in this sector? Dr. Saboo.
We know that diabetes is increasing in our country. One of the major reasons is our lifestyle diseases. It's a lifestyle problem. The unhealthy lifestyle, which is less of physical activity, and the food which we consume is a high calorie, dense calorie. It is very high calorie and dense calorie, and at the same time it contains a lot of carbohydrates, and these are the two major reasons for them to develop diabetes. But other than that, increasing stress level and anxiety, and that is mainly in this COVID era of last 2 years, what we had seen, the people with more stress and more anxiety, that is also one of the important reasons for them to develop diabetes. So if you see the challenges in our country is, it's a complete diabetogenic environment where we are living. We are living with a place where we are doing less physical activity. We are consuming more calorie and more carbohydrate, and we have a lot of anxiety and stress level also. You must have seen irregular sleep, habits with many of our persons. That is also one of the important reasons for them to develop non-communicable disease or these lifestyle diseases. So the other challenge is they are not monitoring. And 50% of our patients they are even not knowing that they are diabetes. And that's again a major challenge, that 50% of our population, they don't know they are having diabetes, and they are diagnosed when they have already the complication. So these are some of the challenges which India is facing during this, of diabetes epidemic, along with the epidemic of COVID also.
Agree with you there. Thank you, Dr. Saboo, for your opening comments. Let me get in Mr. Love Verma. Mr. Love Verma, does India need an affordable and comprehensive diabetes care solution?
Absolutely. As was said, that the majority of the patients of diabetes are, from the low-income families. So what I would really suggest is a national program on diabetes, which identifies people early, as was suggested by Dr. Sahu also. So early detection is very important, and then follow up, right, till they get affordable medicines. And in case there is any complication like diabetes, that definitely leads to a lot of complications. So either insurance should cover that, or our health system should be geared to, and provide end-to-end solutions. So I think a national program on diabetes is the need of the hour.
Yeah, agree with you there. Dr. Pankaj Jethwani, with India being home to 75 plus million diabetes patients and another 200 million at a high risk pre-diabetes category, it also represents the second largest diabetic population in the world, 15% share. Now, what does it translate to in terms of market size, and what are the opportunities here?
It's a very large market, Niranjan. We're spending Indians currently spend about $17 billion on diabetes care. This number is rising very, very quickly. So we're estimating that just in the next 10 years, this number will go up to $60 billion. And a large driver of these costs are direct costs related to diabetes. So this includes your medications, your doctor consultations, your remote monitoring, but a good 30% also includes the money that Indians are spending on better lifestyle choices, including better food, access to exercise, etc. So we believe it's a market to impact, not only for an entrepreneur financially, but also from the large social impact that it can have for Indians.
Agree with you, Dr. Sabu. 75% of India's populace has limited or poor access to diabetes care, and we spoke about how the low and middle income groups are more vulnerable, and we've been talking about affordable diabetes care solution being the need of the hour. Do you think India sees an opportunity here? We can really make it affordable for them than it already is?
So one is, yes, the access to diabetes care is really poor, particularly in the rural parts of the country. We don't have so many healthcare professionals who are trained in field of diabetes, and we can't have all the rural population to take care of their diabetes care by these diabetes specialist doctor. So I think during this COVID time, one thing more we learned is online consultation, teleconsultation. Even our government of India, ICMR, had also given the guideline. Before that, teleconsultation was not a legalized way of doing consulting, but diabetes care can be done with a teleconsultation. So I think the access to the diabetes care now is improved, and it can be further improved if we can have a teleconsultation across the country. The second big important problem is that people are not monitoring their diabetes. If we have a solution which is a connected glucose monitoring, or a patient who is buying the glucose meter and then he is measuring only once in a week or once in a month or once in a year, we don't know anything about it. If something which can be done, like a person is monitoring his sugar and simultaneously a doctor can also see his report on his laptop or on his mobile, and there can be a direct connection can be there. So even a teleconsultation with a connecting glucose monitoring can be a solution. But other than that, there are multiple other things which is like in online consultation as improving the diet. That is very, very important. We don't have so many educators. We don't have so many nutritionists or dietitians who can do the teleconsultation for our patients. And there is a very important factor which is motivation for these persons. Because people with a non-communicable disease without having symptoms, they don't want to go and monitor themselves. They don't want to go and to the doctor also. So in some way, if we can connect with them and we can motivate them to regularly monitor, then we can prevent the complications of diabetes. I mean, a solution can be in the future is the teleconsultation, more motivation for exercise, diet, and increasing the compliance for monitoring as well as for medication can definitely help these patients to have better control and to prevent the complication.
Yeah. And Dr. Sabu, we've seen the possibilities there with the COVID wave, the first and the second COVID wave, digital penetration and online consultation. I mean, anything is possible and everything is possible in India. Let me take this question to Mr. Love Verma. There's also been, Mr. Verma, a consistent push from the Indian government in the last few years through Ayushman Bharat, the central health scheme to improve healthcare quality and access. Now, where do you think the government or governments can come in and play a critical role on this?
I think you raised a very important point. Actually, the second arm of Ayushman Bharat, which is the health and wellness centers, which are being strengthened throughout the country, and there are quite a few of them. So the private sector also needs, the private sector and civil service society civil society organizations. They also need to be roped in, and maybe corporates can also be, asked to put some of the CSR here. The stress in these health and wellness centers is going to be on preventive health. So there should be some advocacy, also some kind of awareness drive, because as Dr. Sahu said, so many people are not keen to get themselves tested. And it is a silent killer. So it is very important that people are made aware of the dangers of this disease. I think once the health and wellness centers kick in and start becoming efficient, we can also introduce the mission I talked about. That can be introduced at the very basic level for awareness and advocacy.
Yeah. And Dr. Jethwani, there is, it's a little complicated, isn't it? Because, a diabetic patient needs to coordinate across platforms to take care of diabetic needs. You have drugs, consultation, monitoring devices, insulin, dietary, lifestyle-related requirements. Doesn't this also call for a comprehensive care solution? How are we placed in that sector?
Yeah, absolutely, Niranjan. Like Dr. Sabu referred to, managing diabetes is not simple, right? And we have all these supply-side constraints ahead of us. In a country as large as India with 1.4 billion people, we have 650 or 700 endocrinologists. We have an acute shortage of dietitians, of nutritionists, of educators. So in this environment where we're expecting diabetes patients to not only change their lifestyle, their food, their physical activity, also monitor themselves, we also expect them to strengthen their medical management through lab tests, medications, doctor consults. We just don't have the supplies to do this the old way. Right? Technology has a huge role to play here today and also in the future. And I think the basis of technology, of bringing everything together, is remote monitoring. Right? You start with empowering the patients to understand their situation, their day-to-day situation. Technology then has a role to help them make day-to-day decisions around diabetes. And then finally use that data to provide them high-quality, affordable solutions, including doctor consultations, medications, labs, when they need it, where they need it. We're seeing a lot of innovation in this space. There are tens of companies that are stepping up. The private sector is stepping up in a big way to fight this huge epidemic. And I feel that the adoption that is today will grow multiple times in just the coming 2 or 3 years.
Well, absolutely. And there is a lot of possibility there, because if there's one country that can do it, it's India. And we've shown it in the past as well. Mr. Love Verma, Dr. Banshi Sabu and Dr. Pankaj Jethwani, thank you for joining us. In fact, new age innovations like continuous monitoring devices, connected devices, app-based doctor support are helping improve diabetes care at a rapid pace across India. And I think affordability is key to large-scale adoption, and India will adopt. Thank you, gentlemen, for joining us.